Hello everyone, now let us discuss about some of the common disorders of digestive system part 3. Coming to polyps in colon, the polyps in colon are generally slow developing benign growths. Slow developing benign growths that arise from the mucosa of the large intestine. Often they do not cause any symptoms. If symptoms do occur, they include diarrhea, blood in the fecus, mucus discharge from the anus. The polyps are removed by colonoscopy or surgery because some of them might be cancerous. Next is dental caries. Dental caries or tooth decay involves a gradual demineralization, that is softening of the enamel and dentin. If untreated, microorganisms may invade the pulp, causing inflammation and infection, with subsequent death of the pulp and abscess in the alveolar bone surrounding the root apex, requiring root canal therapy. And dental caries begin when bacteria act on sugars, produce acids that demineralize the enamel. Dextrin, a sticky polysaccharide produced from sucrose, causes the bacteria to stick to the teeth. And masses of the bacterial cells, dextrin and other debris adhering to the teeth constitute the dental plaque. And saliva cannot reach the tooth surface to buffer the acid because the plaque covers the teeth. And brushing the teeth after eating removes the plaque from the flat surfaces before the bacteria can produce acids. So the dentist also recommend that the plaque between the teeth to be removed every 24 hours with dental floss. Next, coming to periodontal disease. It is a collective term for a variety of conditions characterized by inflammation and degeneration of the gingivae, which are nothing but gums, alveolar bone, periodontal ligament and cementum. In one such conditions called pyorrhea, that is, the initial symptoms include enlargement and inflammation of the soft tissue and bleeding of the gums. Without treatment, soft tissue may deteriorate and the alveolar bone may be resolved, causing loosening of the teeth and recession of the gums. Periodontal diseases are often caused by poor oral hygiene, by local irritants such as bacteria, impacted food, cigarette smoke, and by a poor bite. Next, coming to diverticular disease. In diverticular disease, sac-like outpouchings of the walls of the colon, termed diverticula, occur in the places where the muscularis has weakened and may become inflamed. In diverticular disease, sac-like outpouchings of the wall of the colon, termed diverticula, occur in places where the muscularis has weakened and may become inflamed. Development of diverticula is known as diverticulosis. Many people who develop diverticulosis have no symptoms and experience no complications. Of those people known to have diverticulosis, 10 to 25% eventually develop an inflammation known as diverticulitis. And this condition may be characterized by pain, either constipation or increased frequency of defecation, nausea, vomiting, and low-grade fever. Because diet low in fiber contribute to the development of diverticulitis, patients who change to high fiber diets show marked relief of the symptoms. In severe cases, affected portions of the colon may require surgical removal. If diverticula rupture, the release of bacteria into abdominal cavity can even cause peritonitis. Now coming to colorectal cancer. Colorectal cancer is among the deadliest malignancies, ranking second to lung cancer in males and third after lung cancer and breast cancer in females. Genetics play a very important role. An inherited predisposition may contribute to more than half of all cases of the colorectal cancer. Intake of alcohol, diets high in animal fat and protein are associated with increased risks of colorectal cancer. Dietary fiber, retinoids, calcium and selenium may be protective. The signs and symptoms of colorectal cancer include diarrhea, constipation, cramping, abdominal pain and rectal bleeding, either visible or occult, that is hidden in fecus. Precancerous growths on the mucosal surfaces that we have discussed earlier, polyps, also increase the risk of developing colorectal cancer. Screening for colorectal cancer includes testing for blood in the feces, digital rectal examination, sigmoidoscopy, colonoscopy, and barium enema. Tumors may be removed endoscopically or surgically. Next, coming to peptic ulcer disease. In the United States, 5 to 10% of the population develop peptic ulcer disease, that is PUD, peptic ulcer disease. An ulcer is a crater-like lesion in a membrane. Ulcers that develop in areas of GI tract exposed to acidic gastric juice. An ulcer that develop in the areas of GI tract which are exposed to acidic gastric juice are called as peptic ulcers. The most common complication of peptic ulcer is bleeding, which can lead to anemia if enough blood is lost. In acute cases, peptic ulcers can lead to shock and even death. Three distinct causes of peptic ulcer disease are recognized. The barium Helicobacter pylori, non-steroid anti-inflammatory drugs such as aspirin, hypersecretion of HCl, as which occurs in Zollinger-Ellison syndrome, a gastric producing tumor usually of the pancreas. Helicobacter pylori, which was previously named as Campylobacter pylori, is the most frequent cause. H. pylori, it is commonly called as H. pylori. It is the most frequent cause of peptic ulcer disease. The bacterium produces an enzyme called as urease, which splits up the urea into ammonia and carbon dioxide. While shielding the bacterium from the acidity of the stomach, the ammonia also damages the protective mucus layer of the stomach and underlying gastric cells. The microbe also produces catalase, an enzyme that may protect H. pylori from phagocytosis by neutrophils, plus several adhesion proteins that allow the bacterium to attach itself to the gastric cells. Several therapeutic approaches are helpful in the treatment of peptic ulcer disease. Cigarette smoke, alcohol, caffeine, non-steroidal anti-inflammatory drugs should be avoided because they can impair the mucosal defensive mechanisms, which increases the mucosal susceptibility to the damaging effects of HCl. In the cases that are associated with H. pylori, the treatment with an antibiotic drug often resolves the problem. Oral antacids such as TUMS or Malrox can help temporarily by buffering gastric acid. When hypersecretion of HCl is the cause of peptic ulcer disease, H2 blockers such as Tagamet or proton pump inhibitors such as omeprazole, which block the secretion of H plus ions from the parietal cells, may also be used. Next, coming to hepatitis. Hepatitis is an inflammation of the liver. Hepato means liver. Hepatitis is the inflammation of the liver that can be caused by viruses, drugs, chemicals, including alcohol. Clinically, several types of hepatitis are recognized. The first is hepatitis A, which is also called as infectious hepatitis. It is caused by hepatitis A virus and is spread via fecal contamination of objects such as food, clothing, toys, and eating utensils. It is generally a mild disease of children and young adults characterized by loss of appetite, malaise, nausea, diarrhea, fever, and chills. Eventually, jaundice may appear. This type of hepatitis does not cause lasting liver damage. Most people recover in 4 to 6 weeks. The next type of hepatitis is hepatitis B. It is caused by hepatitis B virus and is spread primarily by sexual contact and contaminated syringes and transfusion equipment. It can be spread via saline and tears also. Hepatitis B virus can be present for several years or even a lifetime, and it can produce cirrhosis and possibly cancer of the liver. Individuals who harbor the active hepatitis B virus also become the carriers. Vaccines produced due to recombinant DNA technology, for example, Recombi-Vax HV, are available to prevent the hepatitis B infection. The next type of hepatitis is hepatitis C, that is caused by hepatitis C virus. It is clinically similar to hepatitis B. It can also cause cirrhosis and possible liver cancer. In developed nations, donated blood is screened for the presence of hepatitis B and C. In the developed nations, the donated blood is screened for the presence of hepatitis B and C. Next is hepatitis D. It is caused by hepatitis D virus. It is transmitted like hepatitis B, and in fact a person must have been co-infected with hepatitis B before contracting hepatitis D. Before contracting hepatitis D, the person must have been co-infected with hepatitis B. And hepatitis D results in severe liver damage and has a higher fatality rate than the infection with hepatitis B virus alone. The next type is hepatitis E. It is caused by hepatitis E virus and is spread like hepatitis A. Although it does not cause chronic liver disease, hepatitis E virus has a very high mortality rate among pregnant women. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.